Do you smoke? Leave a comment below. And if you are one of those people who say quitting was the hardest thing they ever did, share your thoughts. In this video we will cover the why and the how-to of smoking. Why do we get addicted and what happens to our body when we quit smoking? Make sure to watch it till end, and also, if you haven't already, make sure to subscribe and push the notification bell, so you don't miss out on any useful content. So, why do people start smoking? Most smokers started when they were teens. Those who have friends or parents who smoke are more likely to start smoking than those who don't. Many teens say that they just wanted to try it, or they thought it was the cool thing to do. Of course, the tobacco industry also spends billions of dollars yearly to make it seem even cooler. Who is most likely to become addicted? Well, anyone who starts using tobacco can become addicted to nicotine. The younger you begin to smoke, the more likely you are to become addicted to nicotine. Nicotine and other chemicals in tobacco smoke are easily absorbed into the blood through the lungs. From there, nicotine quickly spreads throughout the body and, if taken in small amounts, nicotine causes pleasant feelings. The average amount of nicotine the smoker gets in one regular cigarette is about 1 to 2 milligrams. About 10% of youth are addicted within 2 days of first inhaling from a cigarette, and 25% are addicted within a month. People who have smoked regularly for a few weeks or longer will have withdrawal symptoms if they suddenly stop. These usually start within a few hours and peak about 2 to 3 days later when most of the nicotine is out of the body. Withdrawal symptoms can last a few days to up to several weeks. How powerful is nicotine addiction? Well, about 2 out of 3 of smokers say they want to quit and about half try to quit each year, but few succeed. Regardless of how long someone has smoked, quitting this habit can improve health. Let's see what happens when you stop smoking. First of all, your body goes through a series of changes that last for years. After 20 minutes, already, your heart rate drops. After 12 hours the carbon monoxide level in your blood drops to normal. After 2 weeks to 3 months your heart attack risk already begins to drop. Also, your lung function starts to improve. 1 to 9 months after stopping smoking, your coughing and shortness of breath decrease. After a year your health improves significantly, due to the fact that your risk of coronary heart disease becomes half that of a smoker's. After 5 years, stroke risk is reduced to that of a non-smoker to 5 to 15 years after quitting. After 10 years your lung cancer death rate is half that of a smoker's. The risk of cancers of the mouth, throat, bladder, esophagus, pancreas and kidney decreases. It takes, though, 15 years till your risk of coronary heart disease to come back to that of a non-smoker.